This presentation, as well as the previous and the next two, are supported by this HRSA grant, which is in its 4th year right now, and its intent is to increase the number of geriatricians in Michigan by increasing the number of geriatric fellowships in Michigan. In addition, it is to educate our undergraduate medical students, residents, fellows, and practicing physicians in the state of Michigan, and to do that in the field of geriatric medicine. Now, some of the things I'm going to do today are certainly applicable to people younger than the geriatric population, and so I don't limit what I present necessarily to just aging folks, but at the end of this, you should be able to discuss the philosophy of optimal aging and osteopathic medicine, to discuss the evidence-based research findings of the National Center for Complementary and Integrative Medicine. Some used to be called alternative medicine. I will be presenting highlights of some studies that are available in full on various places in online journals, and you can also take a look at them. There will be a bibliography that should be available to you online. It's fairly extensive, and so we didn't want to pass it out as a handout today. Again, to discuss evidence-based alternative interventions in patient care, and to discuss alternative care interventions with patients that may be interested in talking with you about them. The other objective that I have today is to spark some discussion and thought about alternative forms of treatment. And hopefully we all have a tool belt that we carry with us when we treat patients, and so this may add some things to your tool belt. Optimal aging is the capacity to function across many domains, physical, functional, cognitive, emotional, social, and spiritual, to one's satisfaction and in spite of one's medical conditions. This was originally coined by Bates and Bates, and then the extensive work that I spoke about last year was by Kenneth Brumble-Smith in 2007. He had 2 articles, both are online, and I encourage you to read those. Their reference is also included on the bibliography. In terms of principles of osteopathic medicine, this was the part that I felt between optimal aging and osteopathic medicine that referred to the same piece of body, spirit, and mind. And so that is part of why I use that as the central theme in the geriatric grant, because I feel like we as physicians understand the body a great deal more than sometimes we understand the mind and the spirit. And all of those work together to try and make a human being who they are and give them the uniqueness that we see amongst all of our patients and all of our friends and our loved ones. Now, it may be somewhat simplistic to show you a definition of body, but in my efforts to operationally define body, mind, and spirit, this is the one you know the best, and clearly it is the entire structure with all of the different parts, all of the different cells that we had, but for me, it's the anatomic container of mind and spirit in this presentation. According to Wikipedia, a mind is a set of cognitive faculties that enables consciousness, perception, thinking, judgment, and memory, a characteristic of humans, but also may apply to other forms. whatever its relationship to the physical body, it is generally agreed that the mind is that which enables a being to have subjective awareness and intentionality towards their environment, to perceive and respond to stimuli with some kind of agency, and to have consciousness, including thinking and feeling. And this has been discussed for thousands of years. If you go back in philosophy, you think of, I think, therefore I am. And so the mind thinks and sometimes loses focus. And so part of what we're going to talk today about is how to bring back that focus. The spirit, according to Wikipedia, is an incorporeal, that means without a physical body, I had to look it up, presence or form, but ubiquitous, non-qualifiable substance, quantifiable substance, or energy present individually in all living things. Unlike the concept of souls, often regarded as external, as eternal, and sometimes believed to pre-exist the body, a spirit develops and grows as an integral aspect of a living being. This also has been discussed for centuries. And in my presentation, I'm going to talk about it as life energy or life force. The others that you see are many of the terms that have come forward in various forms of traditional Chinese medicine, as well as some of the other forms of medicine that have occurred around the world. Now, complementary and alternative medicine actually started getting some visibility in the 1980s, and the champion that's often named with that is Andrew Weil. Andrew Weil wrote a lot of books and has made a lot of money and has become sort of the father of integrative medicine. However, in my view, I think that A.T. Still was there first. And so I think that when I was reading about Andrew Weil, and I did that for a health policy paper that was discussing osteopathic distinctiveness, it seemed that one of the people that Dr. Weil actually visited was a DO named Fulford, who lived down in Arizona. And he took some of the pieces of his philosophy from osteopathic medicine. He also went to China, and he went to Japan, and he went to all those places. So that's when integrative medicine really seemed to take a turn for going forward. Now, there are many challenges that we have with the body, and those biological challenges are impaired taste or smell, impaired vision, multiple medications, cognitive deficits, difficulty swallowing, stomach and intestine diseases, and end-stage disease. In the functional capacity, as with aging, we lose manual dexterity and have manual dexterity problems, mobility limitations, falls, incontinence, and increasing chronic disease. In terms of the mind-spirit challenges, one of the first things that I want to talk about is life script, but I will mention it a little bit later. And the other challenges are depression, dementia, bereavement, substance abuse, and pre-death concerns. Now, if you look at the agenda for the rest of the conference, we have an addiction problem in this country, and it is the FDA at this point that is pushing for all physicians to be more knowledgeable. This seems like a paradox, because first we were told we're supposed to treat everybody's pain and give them medications that they need. Now we're hearing we're supposed to not give them pain medicines, and it becomes a quandary. Obviously, the issue is one of moderation. But one of the things that we can do is possibly begin to use some other modalities. Right now, what my understanding is, in terms of the National Center for Complementary and Integrative Health, they say at this point 1 out of 3 adults is seeking some type of alternative treatment, and 1 out of 6 children is receiving some kind of alternative treatment. And so people are looking for something besides what we can offer them in traditional medicine. Now, the National Center for Complementary and Integrative Medicine actually is part of the NIH. It is one of 27 institutes. It was established in October 1998, and it is in the past year of 2014, their funding was $124 million. And that $124 million, a lot of it went to researching studies of the nature that I'm going to mention a little bit later. But, that's a lot of money, folks. And so that you understand, we as osteopathic physicians, and particularly OMT, is considered an alternative therapy. And so we have a great opportunity to get some money to try and actually prove that OMT works. And I will be showing you some studies. But first, the mission of NCCIH is to define, through rigorous scientific investigation, the usefulness and safety of complementary and integrative health interventions and their role in improving health and health care. Their vision is scientific evidence informs decision-making by the public, by healthcare professionals, and by health policymakers regarding the use and integration of complementary and integrative health approaches. These are their goals and objectives, and it is to advance research on mind-body interventions, practices, and disciplines. Again, advance research on natural products, and increase the understanding of real-world patterns, and that is why the public is perceiving something to be a good thing for them and a healthy thing for them. And they want to conduct rigorous research rather than just collect a bunch of stories about what works for different people. And then they need to develop and disseminate objective evidence-based information on complementary and integrative health. So, some of this is done in terms of their collection of data by the use of the National Health Interview Survey. This is conducted by NCHS, which is part of the Centers for Disease Control and Prevention. And they have interviews going out every year to between 35,000 and 40,000 households to ask people questions about their health. And once every 5 years, they ask the questions about complementary and integrative medicine. This is what has been determined in the last study was 2012. And so the most common complementary health approaches among adults still is the use of natural products. But from the study in 2007 to 2012, the practices that have gained the most in increased use are the ones of yoga, tai chi, and qigong, chiropractic or osteopathic manipulation, meditation, and massage. Now, I'm going to deal with the first 3 of those, and I saved massage because I don't have the rest of the afternoon. So, osteopathic manipulation or chiropractic. This is the definition that the NCCIH gives, and they distinguish it as a technique called spinal manipulation. Practitioners perform spinal manipulation by using their hands or a device to apply to control force to the joint of the spine. And this technique can provide mild to moderate relief from low back pain and also will be helpful for headaches. Now, I don't necessarily agree with this, but I need to be consistent in terms of how this information is presented. Now, these are some of the studies that I looked at. Actually, I was very disappointed when I went to the website because I didn't find very many studies on OMT. So I actually went a little further and went to the JAOA because I knew there had been articles published because I actually know some of the researchers who published them. I'm going to try and give you information on the ones that are more specifically related to geriatric patients. And so I'm not going to discuss each of them. I might highlight them. All of these are on the bibliography that you can obtain. So if you want to know anything more about them, also I have included the website of NCCIH on there, which has a great deal of valuable information about what studies are under current studying conditions. So many of the studies that I have here are smaller studies or pilot studies, because again, if you plan to do a large study, you really have to have some idea of what kinds of goals you have and what you're going to achieve. If you can't find in a smaller study anything that is significant, you're probably wasting your time in terms of trying to do it as a major study. The first one, the effects of comprehensive osteopathic manipulative treatment on balance in elderly patients, states it's a pilot study. This was done with a group of investigators, as I said, several that I know. There were 40 healthy elderly people aged 65 or older were enrolled and separated into an OMT group and a control group. Owing to the recruitment process for a limited time for study, the first 20 patients were enrolled in the OMT group, the next 20 in the control group. Patients were excluded if they had a condition that could impair balance. The OMT protocol comprised of 7 OMT techniques applied weekly by the same osteopathic physician before balance tests. Patients in the control group received no treatment. Patients were forced to stand or asked to stand on a force plate to perform 3 balance tests. 1, eyes open, the second, eyes closed, and the third, a modified Romberg. The center of pressure between their feet was recorded for 30 seconds. The average center of pressure displacement for each test was used to determine anterior-posterior sway and medial-lateral sway. Balance tests were performed each week for 4 weeks. Tests were performed in the same time of day as the first tests. And essentially what they found, the OMT group had significantly reduced sway for the eyes open test after 4 visits. The OMT protocol used in this study showed the improved postural stability of healthy elderly patients as measured by changes in sway values. So they found some difference. I believe they're going ahead with this study, and so we wait to hear how their larger study did. This will give them the opportunity to apply for NIH funds, which is not an easy thing to do, but you need some kind of evidence that you have done something in order to do that. The second, the effect of cranial osteopathic manipulative medicine on cerebral tissue oxygenation. This study, again, was small. It was 21 adults, and what they did is applied cranial techniques of augmentation and suppression, and each was supposed to do different things. They measured the heart rates, blood pressures, and other vitals with infrared spectroscopy, and their findings showed that the cranial OMM suppression technique effectively and progressively reduced oxygenation in both prefrontal lobes with the treatment time, which is what they expected to happen. And so decreased blood pressure and heart rate and so forth as a relaxation type of treatment. Now, the third one I'm going to talk to you a little bit about because I have an interest in it. It actually occurred at Michigan State, and it is preventive osteopathic manipulative treatment and stress fracture incidence among collegiate cross-country athletes. And many of you may know Dr. Lynn Brum, or those graduates may actually have participated in this study because it took place over a longer period of time. Dr. Brum was the physician who worked with a number of athletes, and one of them, a hockey player, has donated the OMM suite at Michigan State, where our students actually perform OMM and take their training. Now, this study had more than 1,800 participant examinations that were performed on 124 male and female participants by 3 supervising physician examiners and 141 osteopathic medical students over the course of 5 consecutive academic years. And they were looking specifically for stress fractures in the athletes, which obviously puts the athletes out of commission for a period of time while they are healing. They did find that there was a statistically significant decrease in the cumulative annual incidence of stress fractures in male but not female cross-country athletes after receiving OMT. This decrease was from 13.9% prior to treatment, and then it decreased to 1% in those athletes that were treated. The next study I'm also going to talk about a little bit. This is from the Osteopathic Research Center in Texas. And this was a multi-site number of tests. And so there were sites all over the country that submitted their data to the various, to the examiner or to the author of the paper, which is John Lichardone, who is the head of that center. In this study, there were 3 groups of women who were pregnant and received usual obstetrical care only. And then there was the usual care plus a systematic osteopathic manipulative treatment protocol provided by a DO physician, and then just usual care plus a sham treatment in which the specialist applied pressure with a non-functional ultrasound treatment. And over a period of time, what they found was that there was increased mobility in the patients as they went further along in their pregnancy in the OMT treated group. They still had back pain. However, they were able to functionally move better in the group that actually received OMT. Now, Lichidone did this same, or rewrote this study in another journal and talked about treatment. I'm not going to go into that. The other studies, complementary and alternative therapies for back pain too, was an evidence report that was released. This was a study where multiple examiners did a meta-analysis on the various research articles that were out there. And they came to the conclusion that complementary and alternative medicine therapy tended to reduce pain or disability more than usual medical care, such as anti-inflammatory medications and exercise, physical therapy, or no treatment. They also found that spinal manipulation was significantly more effective than placebo or equivalent to pain medication for reducing the intensity of low back pain. Now, there were several on dose response and efficacy of spinal manipulation, a comparison of manipulation methods and usual medical care for acute and subacute low back pain, a randomized clinical trial. The one that I actually want to talk about a little bit is the last one, which is the risk of stroke after chiropractic spinal manipulation in Medicare B beneficiaries aged 66 to 99 years. And this was a retroactive study in which the researchers looked at Medicare claims on more than 1.1 million people aged 66 to 99 who visited a chiropractor or primary care physician to treat neck pain. And they noted then the incidence of first stroke after treatment, and found in general through all of these patients that there was little, if any, reason to believe that manipulation increased the likelihood of stroke. However, they said there were some slight differences, but they didn't feel that there was any risk of appreciable nature to elderly patients in these kinds of situations. So good news for those of you who do manipulation on your aging patients. The next piece of this is meditation. Meditation is a mind and body practice that has a long history of use for increasing calmness, physical relaxation, improved psychological balance, coping with illness, and enhancing overall health and well-being. It's considered a mind and body practice focusing on the interactions between brain, mind, body, and behavior. And there are many types of meditation, and they can be listed as mantra meditation, relaxation response meditation, mindfulness meditation, transcendental meditation, Zen Buddhist, and then it is noted by the NCIH that yoga and Tai Chi also incorporate meditative components. The elements that are present in all of the meditations are a quiet location with as few distractions as possible, a specific comfortable posture, either sitting, lying down. There is meditative walking or in other positions, a focus of attention, sometimes a word like the old Om, but not always. In terms of some people will concentrate on an object or the sensation of their breathing. And finally, the most important is an open attitude in allowing things, any distractions, to just kind of flow through you. And that is a form of meditation. Now, it's been shown in some of the studies that I've got that practicing meditation may reduce blood pressure, symptoms of irritable bowel syndrome, anxiety, depression, insomnia, and incidence, duration, and severity of acute respiratory illnesses such as influenza. Evidence about its effectiveness for pain and as a smoking cessation treatment, they consider uncertain. Now, these are some of the studies that I looked at, and it was kind of interesting. This first one, the effects of mindful attention and compassion meditation training on amygdala response to emotional stimuli in an ordinary non-meditative state. And what they found was that intensive training did reduce what was a piece called attentional blink. And the participants had gone through, who went through the mental training, were more likely to perceive both pieces of information that were presented to them. The concept of attentional blink is one that if you are presented with a piece of information and a second piece of information is introduced too quickly, that you will not see or recall the second piece of information. And so in this case, the meditators were more able to perceive the second piece of information, and the researchers had it linked to the fact that it supports the idea that brain plasticity, or the ability of the brain to adapt, exists throughout life, and that, that the meditation made some difference in what happened with the folks that they tested. The mental training affects distribution of limited brain resources. I'm going to pass over that one and actually go to the Hosel study, which is mindful practice leads to increases in regional brain gray matter density. In this study, researchers from Mass General Hospital, Bender Institute of Neuroimaging in Germany, and the University of Massachusetts Medical School took MRI images of participants 2 weeks before and after they joined a meditation program. The researchers also took brain images of a control group of 17 non-meditators over a single time period. Participation in the meditation group attended weekly sessions that included mindfulness training exercises and received audio recordings for guided meditation practice at home. And the brain images in the meditation groups revealed increases in gray matter concentration in the left hippocampus, and the researchers have concluded at that point that these findings may represent an underlying brain mechanism associated with the mindfulness-based improvements in mental health, and again felt additional studies were necessary. So this was published in Psychiatry Research. The randomized control trial of mindfulness meditation for chronic insomnia is, again, a small study, but the findings from the study showed that the meditation-based treatments provided improvements by significantly reducing total wake time and pre-sleep arousal. Both meditation-based therapies were better than the self-monitoring on each of the patient-reported measures. Only one significant difference was found between them across the study, and that was the mindfulness medication group had a significantly greater reduction in the severity of insomnia compared with the other group. The potential of effects of meditation on age-related cognitive decline. This was a study that reviewed other studies, and they reviewed 12 studies that in the review that they did not find them all to be truly randomized controls. On the basis of the ones that they felt were appreciably good studies, they concluded that meditation interventions for older adults are feasible, and preliminary evidence suggests the meditation can offset age-related cognitive defects. Good news for those of us who are aging. The other studies dealt with irritable bowel syndrome, and they did find that there was less severity of irritable bowel in the women in the study who actually learned meditation and began practicing meditation on a regular basis. Again, the transcendental meditation program showed that it reduced blood pressure, psychological distress, and was done with younger adults, but it was felt that it improved their coping skills. The randomized controlled trial of mindfulness-based stress reduction to prevent flare-ups of ulcerative colitis in patients with inactive ulcerative colitis was also found to be positive. We're going to move to yoga. Now, I don't know about you, but a lot of my patients do yoga already. I've not tried yoga. I've been doing transcendental meditation for many, many years. I actually started that back when I was a psychotherapist in the 70s, prior to medical school. And at that point, I found meditation to be very helpful to me. Some of my classmates, used to see me before our 8 o'clock exams sitting on a couch outside or inside of one of the places in Fee Hall, because I felt that it allowed me to focus more on the things that I had studied the night before or the week before or several weeks before, and made a difference in my exam skills as I went in to take my exams. Yoga, some of my patients have told me that this has made them more able to concentrate. Yoga is a meditative movement practice with historical origins in ancient Indian philosophy. In people with chronic low back pain, a carefully adapted set of yoga poses may reduce pain and improve function. Like other forms of regular exercise, yoga may have health benefits such as reducing stress and improving overall physical fitness, strength, and flexibility. For information, there are numerous types of yoga. Hatha yoga is the most commonly practiced in the US and Europe, and emphasize postures and breathing exercises. The other styles are listed here also. One of the studies that we're going to see actually talks about a different type of yoga. Now, Qigong and Tai Chi are both listed under yoga as far as NCCIH is concerned. I went a little further with this because I found in researching them a little bit more that they were significantly different than yoga, and they were a thing unto their own. Now, Qigong is the discipline from traditional Chinese medicine that combines gentle physical movements, mental focus, and deep breathing. So there are a number of different disciplines under Qigong. Tai Chi, which surprised me, well, it is known as moving meditation, but it actually was listed as martial art. And again, the discipline of Qigong combines the gentle physical movements, mental focus, and deep breathing with the integration of physical postures, breathing techniques, and focused intentions. And the three types are the martial form, the medical form, or the spiritual form. All have the same things in common. They involve a posture, whether it's moving or stationary, breathing techniques, and mental focus. This from the National Qigong Association and more. The practices vary from the soft internal styles such as Tai Chi to vigorous styles such as Kung Fu. And the gentle movements can be easily adapted for those who are physically challenged and can be practiced by all age groups and have been shown to be helpful in chronic low back pain. And the other pieces, these practices tend to increase the qi. Other practices circulate the qi and use it to cleanse and heal the body. Store it. Some people say they can store the qi and emit the qi to help heal others. So, a little different. In terms of our studies, the ones that I'm going to look at again are the biomechanical demands of standing yoga poses in seniors. This is this is the last one that is here. And this was researchers from USC's Division of Biokinesiology and Physical Therapy, University of California, LA. And they used biomechanical methods to measure the physical demands of Hatha yoga in 20 older adults. And they were taught introductory poses for 16 weeks. And we're performing on a continuing basis, and they found that the musculoskeletal demand varied significantly across the different poses. They noted that this study was a first step in a more tailored evidence-based yoga program that addresses individual-specific training and rehabilitation goals in seniors, and again, found to be helpful. Now, one of the reasons that I'm doing this talk is I actually had tried to enlist a psychiatrist friend of mine who is in Oregon. Her name is Lynn Hughes. She used to practice in Michigan, and in discussing what she was doing, I ran into her in Seattle at the AOA meeting, and she told me that she was actually working to teach yoga teachers how to interact with Alzheimer's patients, and that they were having a significant improvement in the Alzheimer's patients that they were treating. So she was unable to come for this, and so that intrigued me, and I decided to take a look at some of this and do this presentation. Probably the study that I want to bring to you the most is one that's called Augmenting Immune Responses to Varicella-Zoster Virus in Older Adults, and this is a randomized controlled trial of Tai Chi. So we're going to move along here. And this was actually in the Journal of American Geriatric Society news, and it was a controlled trial at the University of California, Los Angeles, including 112 healthy adults, 59 to 86. In this, Tai Chi was found to increase participants' immunity to varicella, and Tai Chi combined with the vaccine produced a significantly higher level of immunity, about a 40% increase over receiving the vaccine alone. The study showed that the Tai Chi's group rate of increase in immunity over the course of the study was double that of the health education group. Tai Chi has also been shown to be helpful in chronic sleep disorders. Tai Chi has actually been found also to help in postural stability in patients with Parkinson's disease. This particular study appeared in the New England Journal of Medicine in February of 2012. I'm going to move on because I think I'm running out of time. These are some of the other complementary and alternative interventions that are addressed on the website that I talked with you about on the NCCIH. They are things that we are actually looking at in our grant to at least bring to the forefront in mention with all of the people that we're trying to educate. We're looking at what there might be to give you additional tools to work with your patients. Again, these are things that are different from what we're used to thinking about as physicians. And so I think I'd like to hear your comments, and if you think this is all garbage, tell me that. But I found it interesting, and I think there are some real possibilities of other things that we can use. Patients so often want that pill. As I was preparing this piece at various times, I will sometimes have the TV on, and all of the drug announcements that come on where the companies are purporting their new drug that is the magical cure for everything, and they say, go and ask your doctor about this and, see if it might work for you. And so there are lots of things out there that have been out there for thousands of years that may have validity and that may be a whole lot less addictive. And some of these things, meditation has been addictive for me because I've continued to do it for all of these years, and I still do it daily. And I feel that it's made a difference in my life. You each have to decide for yourself. But in terms of the body, mind, and spirit, the body heals with play, the mind heals with laughter, and the spirit heals with joy. May all your spirits experience joy for the rest of your life. Thank you.